First, we had a masterclass and we compared the actions of the lasers towards the classic methods of the peels that we are using for the rejuvenation of the face. And we presented the updated technology on lasers and the developments that we have regarding the facial rejuvenation with lasers. And we explain exactly how the combination of non-invasive and invasive techniques in aesthetic surgery can improve the final aesthetic results of the patient. And the message is that we can never abandon our surgical operations and our surgical targets on aesthetic surgery, but we can use them in combination with technology and lasers and other devices that can improve the final result, especially working with technology on the texture of the skin. So this was one of the innovations that we presented in the yesterday, first day of this course. The other issue was the development of a specific blepharoplasty technique which can give much better results at the end of the day to patients that they are interested in rejuvenating the periorbital region. And this is in combination or without combination with lasers, but with the use of a very simple technique which really is a revolution on improving the periorbital region. This was what actually was presented from our side. Many colleagues of mine, professors from the Education Council of ISAPS, which I'm honored to run as the chair of the Education Council of ISAPS, have also presented several innovations in techniques on facelift, on abdominoplasty, and on trunk surgery for aesthetic and reconstructive reasons. And I believe that this is the main message that we have to pass to the people that they're attending this course. Although the message on many presentations was the less is better, because it gives less possibilities for complications. This is not 100% what we have to follow. What we believe is that the expectations of an aesthetic patient have to comply and meet the expectations of the surgeon. The important thing is that the surgeon should explain the expectations that the patient can have from a specific aesthetic intervention, whether it is a surgical one or a non-surgical one. There is no doubt that non-invasive surgery, non-invasive techniques have actually conquered the area of aesthetic surgery. We do not underestimate them. We believe in this new concept in aesthetic surgery, but non-invasive techniques cannot substitute our traditional surgery in aesthetic surgery. So what I believe is the new message is that the combination of techniques is what can give to a patient the best results on what he's expecting from an aesthetic intervention. I believe that media play a very interesting and important role, not only in aesthetic surgery, but also in our lives. However, I believe that media have to actually follow specific rules that would pass messages to the public that will be as close as possible to the scientific reality. Sometimes we have over-exaggerating messages from media. Sometimes we have negative messages from media to the public. I believe that should we should have a consensus regarding the level of the information that will pass to the public, and this can only be achieved by liaising between science and media. And I believe that media can also be benefited from that, because the more correct information that media pass to the public, the better credibility and the better trust the public has to the media. And the same with the doctors. What they pass through the media should be accurate, so that the patients and the people that are interested in aesthetic surgery will achieve and will receive messages that will be useful for their life and not lead them to non-correct destinations. There's no doubt that media influence a lot public. This is something worldwide accepted, okay? So because media have this very serious influence on the public, I believe that they should act in this way, that whatever they transfer to the public should be accurate and give the opportunity to the people to be more educated, other than being non-correctly informed on specific matters in aesthetic surgery. The Romanian Aesthetic Surgery Society has done a lot of steps forward and has been organizing educational events in Romania the last years in cooperation with the Education Council of ISAPS. And this is another very successful event with excellent names and professors being invited here in Poiana Brasov. And the level of the lectures and the information transferred to the audience is very high standards. We believe that the Romanian Aesthetic Society will have more opportunities to gather professors from the Education Council of ISAPS and give more information and educate the local plastic surgeons, because ISAPS is a society which main target is aesthetic education worldwide. So we're open to bring professors all over the world, including Romania, and transfer the messages and the innovations and the developments of aesthetic plastic surgery in order to create an educated community of plastic surgeons all over the world. This will be very important for the safety of the patients, because safety of the patients is another destination and target of ISAPS, together with the aesthetic education worldwide. These two things are very well linked. So education gives safety to our patient, and safety is the most important thing.